Okay, Nick, but we're going to begin with a record-breaking number of new coronavirus cases here in Michigan. 27,346 cases over the past 2 days. That averages out to 13,600 cases per day. 277 new deaths are also being reported, including 165 from a vital records review.
And as you've noticed over the last few days, the averages keep going up. The 7-day moving average has more than doubled over the last 3 Wednesdays. On December 22nd, Michigan averaged 5,700 cases a day. Today, that number is 12,000. Today's daily average, by the way, the highest it's ever been since the start of the pandemic. And with these new numbers, our Dr. McGeorge spent some time today talking with the state's chief medical officer to get her take on the trends being seen here and across the nation.
Certainly, there's no shortage of things to talk about, so let's go ahead and bring in Dr. McGeorge right now. Frank, we're guessing neither of you were surprised by today's number of new cases.
Well, you know, Kim and Jason, at the time that I talked to her, she actually didn't have today's newest numbers, but she did reflect on the trend we've been seeing. Now, personally, I will say today's numbers are completely consistent with the Omicron spike that we're currently in. And while it may be true that Omicron overall doesn't cause as severe illness, these insanely high case numbers are still translating into an overwhelming number of patients in the ER and the hospital.
For everyone who's following the numbers, not only in Michigan, but around the country, I think it's certainly a concerning trend. And when we look at some of our neighbors, especially some of our East Coast neighbors, it tells us what may be yet to come.
Dr. Natasha Bagdasarian, Michigan's chief medical executive, points out that our situation is very serious.
This is concerning. What we have been seeing so far has been our Delta variant surge. We are now starting to see our Omicron surge.
Given surging cases, some people have been critical of schools not going virtual, but Bagdasarian believes it's not one size fits all.
I think that schools, school districts, and local health departments have to make decisions that make sense locally. So they have to take into account what's happening locally, as well as what mitigation strategies they have been able to implement. We really believe that schools should be one of the last places to close down and one of the first places to open.
And to keep schools and other vital sectors open, we need to work together.
We're in a really critical time for our state. We went into this Omicron surge in a bad place. We went into this with hospitals really over capacity and asking for help. We've had to ask for help from our federal partners already. So we're going into this in a really bad place. Now is really the time for us to come together as a community. Individuals may think that they are in low risk groups and perhaps they don't need to get vaccinated, perhaps they don't need to wear a mask, but now's the time to really do this as a community and to come together.
Now, unfortunately, Omicron is just a different beast than other variants, and controlling its spread just seems to be darn near impossible. Frankly, at this point, anyone who isn't taking precautions seriously is at risk of getting infected. But for sure, the most serious infections are going to occur most often in unvaccinated people. Right now, there is basically unchecked spread, and we need to protect ourselves and just hope that this spike burns itself out quickly, as it did in South Africa.
Yeah, that really is what I think everybody is hoping. Frank, we keep hearing about these monoclonal antibodies. How's the state doing on treatment medications like that?
Well, you know, Bagdasarian said they are in short supply everywhere in the U.S., and right now they're being strategically targeted at only the highest risk cases. It's a critical situation.
Yeah, okay. Dr. McGeorge, thank you.